Local news that matters. You're watching KLBK Bright and Early.
Welcome back. So Dr. Victor Test joins us now from Texas Tech. He is the Division Chief for Pulmonary Critical Care and a professor at the Texas Tech Health Sciences Center. So Dr. Test, thank you so much for being with us.
Howdy, and thank you for having me.
Absolutely. So I wanted to ask, let's just start with the basics. What is COVID-19? And you know, it's not like the flu. So how is it not like the flu? Tell me a little bit about it.
Well, the coronaviruses are been around for a long time, and they're very common in certain strains of animals, for example, bats. But they also can give symptoms like the common cold in people. This virus, the coronavirus 19, has mutated. So what makes it much different than the normal coronavirus and different than the flu are several things. The first is it's much more infectious or contagious than regular influenza. In fact, if you look at the relative infectiousness, the only thing that I know of that's more infectious is the measles.
Wow.
So it spreads quite easily from person to person, and it spreads with droplet and airborne sort of infectious things. So you can get it from breathing air. That's why they talk about keeping your distance from people. And now one of the reasons we have people wearing masks, which we'll maybe talk about a little bit later. The other thing about it that's different than the flu is that most patients with influenza, when they get the influenza and get infection, they get sick right away and they feel terrible. They have high fever and severe chills and aches, and it occurs right away. And then they become more infectious from that point on for a few days until their fever goes away. This virus is sneaky. So a lot of patients have no symptoms at all. We think maybe up to 50% of people who've undergone screening and don't have any symptoms at all.
What makes people so sick with the COVID-19 symptoms, and what does it do to the body?
Well, it does a lot of things, and it, unlike the flu, where everybody has a pretty good idea about the symptom complex of flu, the onset of symptoms is really gradual, but until it's to a certain point, in a very small subset of people, about 20%, they will develop initially with cough, and then shortness of breath, and then fever. And at the time of diagnosis, a lot of patients don't have fever, but they almost all develop fever within the first day or two after diagnosis. You can have symptoms of diarrhea and occasionally sore throat, but mainly what we see is shortness of breath and cough. And it's very often mistaken for much more common symptoms like allergies or the common cold at first. But in that group of people who get sicker, once they start to develop shortness of breath and fever, they often get sick quite rapidly. And the effect on the body is quite profound. It can affect any part of your body pretty much. It can affect your kidneys and your liver. It can affect your blood vessels so that they don't squeeze the way they're supposed to and hold your blood pressure up. It makes your blood vessels in your lungs leak fluid. It makes the blood vessels they act abnormally in the lungs so that they don't control blood flow the way they're supposed to. And it also causes some people to get confused. And then the last thing is that's really unique about this compared to the influenza is it tends to make people's blood clot a lot more readily. And so they're more prone to blood clots than a normal person with the flu.
My goodness. Talk to me about medications and masks.
Well, the masks, there's been a lot of crazy information about this. And I think the reality is that almost everybody at first was confused about what to do. And that starts from the beginning of when the disease was described in China. Masks are of different kinds. There's the kinds that you see people wearing around that are homemade, and they really serve to protect you from spreading the germs to other people. They're not perfect, and they're certainly not as good as a regular surgical mask, but they keep you from spreading germs to other people, which is really important, okay? Particularly since some people have the disease and don't have symptoms. Then there's the surgical mask, which is what the paper-like mask that you see in the hospital, and those give you a higher degree of protection, but they're not perfect. And so then the higher level of protection is called an N95 mask or an N100 mask. And that's what you see when we take care of the nurses and doctors, where when they take care of these really sick people, because they filter out 95% of the particles that a patient will exhale. And these patients, when they're critically ill, begin to cough and release the virus through their cough and their secretions at a much higher rate than they do when they're minimally symptomatic, although they can still spread the virus. But masks are important now, and I think everybody was a little slow in realizing how important they are in just preventing other people from getting the disease, or in other words, keeping me from spreading my germs to you. The medications that for this virus are real. There's a lot of stuff in the news. Okay. You hear talk about medications like for malaria and medicines that we commonly use to treat lupus, chloroquine, hydroxychloroquine, medicines to treat viruses like the flu, Tamiflu, don't really work. You hear about using medicines that we use to treat, for example, HIV. The reality is that we don't have any good evidence that any of those things make people better. We have anecdotal evidence where somebody takes the medicine and they feel better. But we don't really have very good evidence for those. So right now, the main treatment when you get really sick is still good supportive care with oxygen and preventing you from getting other problems and taking care of the more severe effects of the illness.
So the key right now is what many medical professionals are emphasizing, which is staying at home, social distancing, just keep it basic, right?
Yes, ma'am. I mean, the safest way to not get a virus is not to be around other people. That's obviously really hard. It's really hard if you're in the medical profession, because after all, we're up here taking care of patients. It's hard in any kind of job, and so that creates a real burden for everyone. But it is clearly the best way to stop the spread of the virus.
All right, you heard it there from Dr. Test. Stay at home, social distancing is key. All right, Dr. Test, thank you so much for being with us.
My pleasure, anytime.
You have a good rest of the day.
You too.
All right, we'll be right back.